Errin is a medication that is used to prevent pregnancy. It is often called the mini pill because it does not contain any estrogen. Instead, it contains norethindrone, which is a form of progestin that helps to prevent pregnancy. It is important to note that while the mini pill is more effective than certain other methods of birth control, such as condoms or diaphragms, it is less effective than combination hormone birth control. This is because it does not consistently prevent ovulation. Errin is typically used by women who cannot take estrogen. It is very important to take this medication exactly as prescribed in order to reduce the risk of pregnancy. It's important to know that using this medication does not protect you or your partner against sexually transmitted diseases. The recommended daily dosage for Errin is 1 tablet at the same time every day. The best time to take this medication is determined by your healthcare provider, so be sure to follow their instructions carefully. Before you start taking Errin, make sure to read the patient information leaflet provided by your pharmacist. It contains very important information on when to take your pills and what to do if you miss a dose. Take this medication by mouth as directed by your doctor, usually once daily. It's best to pick a time of day that is easy for you to remember, and take your pill at the same time each day. If you experience stomach upset or nausea with the medication, taking it after your evening meal or at bedtime may help. You may choose to take this medication at another time of day that is easier for you to remember, but it's important to take it at the same time each day, 24 hours apart. Start taking this medication on the first day of your menstrual period. If you begin taking it on any other day, use an additional form of non-hormonal birth control for the first 48 hours to prevent pregnancy until the medication has enough time to work. Continue taking 1 tablet every day, with no break between packs. Your periods may be irregular, or heavier/lighter than usual, and you may experience vaginal bleeding between periods. Do not stop taking your pills if this happens. If you miss a pill, start a new pack late, or take your pill at a different time of the day than usual. Use a backup method of birth control every time you have sex for the next 48 hours. If you have any questions or if any information is unclear, consult the patient information leaflet or your doctor or pharmacist. If you experience nausea, vomiting, headache, bloating, breast tenderness, or weight gain, these are common side effects of Errin. You may also experience vaginal bleeding between periods or irregular periods. If any of these side effects persist or worsen, it's important to talk to your doctor or pharmacist right away. Errin has been prescribed to you because your doctor has determined that the benefits outweigh the risks. However, it's important to be aware of potential serious side effects. Contact your doctor immediately if you notice any lumps in your breast, changes in mood such as new or worsening depression, severe stomach pain, unusual changes in vaginal bleeding, dark urine, or yellowing of the eyes or skin. While rare, a serious allergic reaction to Errin can occur. Seek medical help immediately if you experience symptoms such as rash, swelling, severe dizziness, or difficulty breathing. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before taking Errin, it's important to inform your doctor or pharmacist about any allergies you may have to norethindrone or other progestins, as well as any other allergies you may have. This medication may also contain inactive ingredients that could cause allergic reactions or other issues, so it's essential to discuss this with your pharmacist for more information. It's also crucial to inform your doctor or pharmacist about your medical history, especially if you have had an abnormal breast exam, cancer, especially endometrial or breast cancer, low levels of good cholesterol, HDL, depression, diabetes, severe headaches/migraines, a history of yellowing eyes/skin, jaundice, during pregnancy or while using hormonal birth control, liver disease, or unexplained vaginal bleeding. If you are planning to have surgery, make sure to inform your doctor or dentist about all the medications and products you are using, including prescription drugs, non-prescription drugs, and herbal products. Errin may cause blotchy, dark areas on your face and skin, melasma, and sunlight can worsen this effect. It's important to limit your time in the sun, avoid tanning booths and sun lamps, and use sunscreen and protective clothing when outdoors. It's important to note that Errin should not be used during pregnancy, and if you become pregnant or suspect that you may be pregnant, you should inform your doctor right away. Additionally, this medication can pass into breast milk, so it's essential to consult your doctor before breastfeeding while taking Errin. It's important to be aware of potential interactions with other medications. Some drugs may decrease the effectiveness of hormonal birth control, increasing the risk of pregnancy. Examples of these drugs include griseofulvin, modafinil, rifamycins, ritonavir, St. John's wort, drugs used to treat seizures, and HIV drugs. When starting a new medication, it's important to discuss with your doctor if additional reliable birth control is necessary. If you experience any new spotting or breakthrough bleeding, it's important to inform your doctor, as it may be a sign that your birth control is not working effectively. Furthermore, Errin may interfere with certain lab tests, potentially causing false results. It's crucial to inform lab personnel and all your doctors that you are taking this medication. Always follow your doctor's instructions and never start, stop, or change the dosage of any medication without their approval. If you or someone else has taken too much Errin and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local Poison Control Center at 1-800-222-1222. In Canada, contact your provincial Poison Control Center. Symptoms of an overdose may include severe nausea, vomiting, and sudden or unusual vaginal bleeding. When using Errin, it's important to take it at the same time every day to ensure its effectiveness. It is typically taken once a day, with or without food. It's best to choose a time that is easy to remember, such as with breakfast or before going to bed. It's important to follow the instructions provided by your doctor or pharmacist for the best results. Errin is a progestin-only birth control pill. It is used to prevent pregnancy and works by preventing the release of an egg during the menstrual cycle. Additionally, it thickens the cervical mucus, making it harder for sperm to reach the egg. It also changes the lining of the uterus, making it more difficult for an egg to attach to the uterine wall. Remember to take Errin exactly as prescribed by your doctor to ensure its effectiveness. It's important not to share Errin with others. While taking this medication, it's essential to have regular complete physical exams, including lab and/or medical tests such as blood pressure, breast exam, pelvic exam, and pap smear. Follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. If you miss a dose of Errin, refer to the product package for instructions. It's important to use backup birth control, like condoms or spermicide, to prevent pregnancy. If you have trouble remembering to take your pills, talk to your doctor about other birth control options. When storing Errin, make sure to keep it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. It's important not to flush Errin down the toilet or pour it into a drain unless specifically instructed. When it's expired or you no longer need it, make sure to properly discard it. You can consult with your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.